Hello, mentors. My name is Catherine, and I work with the Amachi mentoring program. I think I've met most of you guys, but today I wanted to take some time to just talk a little bit about the opioid crisis and just educate you guys a little bit more on how it might affect your mentees and their families. So I want to just kind of go through some slides, got a short presentation here that I'm going to share with you guys. I'm going to share my screen and really just kind of talk about the scope of the opioid problem. So that's really what this training is going to be about, and hopefully it'll be educational for you guys and helpful. So I do have some notes because I do not pretend to be an expert and know everything there is to know about this, and so I'm going to refer to those as I go throughout this presentation. But I hope that you find something helpful that can really be a takeaway for you as you continue your mentoring relationship with your mentee. So with that, we'll get going. So the objective here, we're just going to focus a little bit on the timeline of the emergence of the opioid crisis, kind of that big picture, since we're talking about the scope of the the epidemic. And then we're also going to talk about just contributing factors that kind of led to this epidemic. So that's where we're going to start. Okay, so just to give kind of a maybe higher level, or maybe this is review for some of you guys. So a prescription opioid, those are powerful pain-reducing medications that are derived from morphine and often referred to as narcotics. So you've probably heard that terminology before. You may know that that's kind of what we're talking about here. So the use of opioids is inherently coming with both benefits and with risks, as you can see there on the screen. Obviously, it can manage pain and are prescribed for certain things, but there are also some potential risks that are associated too. So opioids, what they do, they attach to neurons called opioid receptors on the nerve cells in the brain, spinal cord, gut, and other parts of your body. So when this happens, the opioid blocks the pain messages sent from the body. So it's really kind of almost triggering your mind, okay, the pain is reducing, and it's kind of blocking that to the central nervous system. So when opioids bind to these receptors, they mimic the effects of other neurotransmitters in the brain, so kind of like endorphins, which can also cause euphoria and decrease stress and anxiety. So for this reason, opioids have a high potential for misuse. And the longer that a person uses an opioid, the higher risk for that dependence and long-term use that they're going to have. Some of those side effects could be things like sleepiness, constipation, nausea, and some more serious side effects can even be life-threatening. And we'll kind of talk about that a little bit more. Some symptoms of opioid overdose can include shallow breathing, slow heart rate, and loss of consciousness. And if ever a person is experiencing an opioid overdose, the antidote can be used to temporarily reverse an overdose to allow enough time for a person to seek professional medical care. And so this drug is called naloxone, or you might have heard it called Narcan, and it's a nasal spray that kind of reverses that overdose temporarily so that a person can then get to an emergency facility and get proper treatment. And so obviously we know that there are overdoses that occur every day in our country and even in our community, and the result of those can potentially be death if they're not reversed with Narcan or seek a professional medical attention immediately. So some commonly prescribed opioids, they come in a variety of different forms, and these are some of the most common that you see there on the screen. So hydrocodone, fentanyl, that's increasingly become a problem, resulting in drug overdose deaths, and due to its extreme potency, which we'll talk about in a minute, it's the #1 drug related to fatal overdoses, specifically here in East Tennessee. So fentanyl is also a synthetic opioid, but according to the Drug Enforcement Agency, it's 80 to 100 times stronger than morphine. And so pharmaceutical fentanyl was developed for pain management treatment of cancer, actually. But because of its powerful properties, it's also derived from misuse. And fentanyl is often added to heroin to increase its potency. And we'll talk about that a little bit in a second. And then some other ones, Vicodin, Loratabs, Oxycontin, and then heroin. So heroin is also an opioid, although it is an illegal drug. The photo depicted on this slide here, you'll see that bottle of heroin, and that's granulated sugar in there. And then you'll see that bottle of fentanyl, and you'll see the sugar in there as well. So that's showing a lethal dose of heroin compared to that lethal dose of fentanyl. So you'll see there's a lot more heroin than there is fentanyl in those two. So notice how small that fentanyl would be that could cause that fatal dose, that lethal dose. And there's a trend of heroin being cut or laced with fentanyl. So you don't know what you're getting when you use heroin, and that can be really, really dangerous. So that's just a little bit about opioids and some of the names if you've heard it or maybe you haven't before. So there's a lot of factors that led up to the opioid epidemic. We've got timing, we've got geography, and that's really important for us here in East Tennessee, especially thinking about rural Appalachia, which is nearby. We've got culture, so associating things like trust placed on physicians and their knowledge and just different directives there. We've got perceptions, so the healthcare community treating symptoms instead of the root causes and the perceptions that exist there. And that can be really complicated. And it's hard because it's more expensive to treat the root cause. And so sometimes just the symptoms are being treated, which can lead to instant gratification, but long-term can be not the greatest in certain circumstances. And then the desire for patients to have that immediate pain relief and have that instant gratification is something that people are wanting. And then cost as well. Healthcare providers and insurance carriers with a strong desire to keep costs minimal can sometimes be up in the air. And so that can be a contributing factor kind of to this perfect storm. So lots of dates and names on this slide here. And I just want to highlight a few. I don't want to spend a ton of time here. Maybe if you're a history buff, this is very enjoyable for you and you can take a screenshot of this and learn more about it. But for some people, it may be a little overwhelming to see all these dates. But you can see back in the 1800s, Civil War, morphine was used in the battlefield for an anesthetic. And then late 1800s, heroin was first produced commercially by Bayer Company. And it was believed to be less habit forming than morphine. So then early 1900s, we've got Congress passing a Harrison Narcotics Act. So talking about prescriptions for narcotic drugs. Then we've got the Anti-Heroin Act banning the sale of heroin. Then we've got the William Douglas Adams Incorporated in the 1940s. And then a company that became Purdue Pharma financed and purchased the Sackler family, so that previous agency. And then in the 70s, Controlled Substances Act becomes law. And in the 80s, we've got a letter titled The Addition, Rare, and Patient Treated with Narcotics. And that was published in the New England Journal of Medicine. Not a study, but widely cited as proof narcotics were safe. So you've got people thinking, okay, this is safe, 1980, and they're thinking, okay, this is safe. And then in the 90s, the AMA, which we're going to talk about this a little bit more, recognizes pain as the fifth vital sign. So blood pressure, heart rate, respiratory rate, temperature, and then also pain. And then the 90s, Medicare has a funding formula that requires hospitals to prove they provide good care through patient satisfaction surveys. And these formula rewards hospitals that are rated high by patients while penalizing those that are not. So that can get a little dicey, especially when we're thinking about this. And then the rest of this timeline, so OxyContin is introduced and aggressively marketed as a safer pain pill by the Purdue Pharma company in 95. And then in 2007, the government brings criminal charges against Purdue Pharma for misleading advertising practices. And they plead guilty and pay a lot of money and sentenced to probation. And then in 2016, we've got the CDC publishing guidelines for prescribing opioids for chronic pain. And then in 2018, Medicare changes patient satisfaction surveys and drops pain treatment satisfaction for reimbursement. And then we've got several journal entries published that year, an advisory recommending Americans start carrying naloxone or Narcan, like we talked about earlier. And so that was back in 2018. So this is the rating scale that was mentioned earlier when the AMA kind of put this out and just talking about pain and that rating scale. So the AMA is the American Medical Association, and they adopted pain as the fifth vital sign. So the healthcare industry adopts both the numerical rating, that top rating there that you can see the different numbers. If you've been to the doctor, you've maybe gone through a surgery and then come out, they'll probably ask, tell me what your pain is on a scale of 1 to 10. And then this is the Wong-Baker-Faces pain rating scale to assist patients in rating their level of pain. And that's really subjective. And so this was introduced, and both of these are kind of adopted and used. So when we think about prescription growth, opioid prescriptions exploded in popularity between 1991 and 2013. So they increased by 172%. So you can see there on the slide, 76 million in 91 and 207 million in 2013. So 172% increase. And corresponding increases in the substance use disorder were also recorded during this time for diagnosis of substance use disorder, opioid treatment admissions, and opioid overdose deaths. So that's kind of a little bit about that increase, and obviously leading to more overdoses, more deaths that we've seen in our country. And then, so poisoning, talking a little bit about that, is the leading cause of death from injury in the US. And you can see here in 2007, poisoning actually surpassed motor vehicle traffic fatalities, which is kind of interesting because obviously we know anytime we get in the car and go out, we have the risk of potentially dying in a motor vehicle accident. It's common, and that is a very risky thing that we do every single day. But here we see that poisoning even increased, surpassed the car accident fatalities. And so really this change was attributed to the rapid increase in opioid overdose deaths, and that has been tracked as well. And you can see there on the screen that chart. So among more than 72,000 drug overdose deaths estimated in 2017, the sharpest increase was among deaths related to fentanyl, with nearly 30,000 overdose deaths. So again, going back to fentanyl and just how potent it is, how a little bit can do a lot of damage, and how it's increased in popularity as well, leading to that. So we look at this map, and this really shows the quantity of opioids dispensed per person across the country. So you can see here that Alabama, Arkansas, and Tennessee are ranking among the highest. You can see that darker pink color there. So again, we are kind of in the heart of this. We're seeing that more and more opioids are being dispensed in our area, especially as we are on that east side, getting towards rural Appalachia, like I mentioned earlier. Tennessee is definitely on the higher end of all the states. Okay, so just looking at this a little bit, overprescribing complications. So just to see that on the screen, 1 in 4 patients were given opioids equal or greater to 90 MME per day, and those doses were considered so strong that the CDC recommended avoiding them because patients taking those amounts are 10 times more at risk as an overdose death. So that's a huge number, 10 times more at risk for these opioids to become addicted in them. 9 in 10 surgery patients with leftover opioid pills admit that they haven't properly disposed of them, either by keeping them in their home, giving them to family or friends to help manage their pain, or improperly discarding the medications. And that's a really big issue. You know, there's a lot of talk around this, just properly disposing of medications that you don't end up needing or using, and you know, keeping those to properly dispose those at a pharmacy drop-off location, or when they have the big days where you can turn back in unused prescriptions. That's really important to do that so that other people don't get their hands on them, or potentially if you have kids or animals in your home that could potentially get their hands on those, that can be very dangerous, definitely. So make sure you're properly disposing of your medications. And then almost half of 40 to 54-year-old patients with leftover pills kept them in their home. So again, really important that we dispose of leftover medications. That's really critical in combating the opioid epidemic for sure. All right, so we've got another map here. Let me take a sip of water. It's kind of weird when you're just talking to yourself on the Zoom call here, but again, hopefully this is helpful in some way and not super boring. So looking at this map, states identified by the color blue have drug overdose death rates statistically higher than the national average. So you can see a lot here on the east side of the map there. Obviously Tennessee, again, among those as well. And you can see a couple of those Midwest states and then up in the New England area as well. The gray states are the US average, so they're really hitting the same as that US overall average rate. And then the green states have lower overdose death rates. So there's a little bit of information for you. And then this chart is showing us which states have the highest rates of opioid overdose deaths and compares that to the opioid prescription rate. So you can see down there, Tennessee is circled for you in that second column. So Tennessee ranks the highest for opioid prescription rate, which is interesting and obviously a contributing factor to overdoses in our state alone. Okay, so this data comes from 2018, and this is the overdose deaths here in 2018 in Tennessee. So 1,818 died of a drug overdose. And if you break that down, that's nearly 5 people per day in our state who are dying due to drug overdose. Drug overdose typically occur one at a time, so the impact of these deaths is often overlooked. And I think that's a really important thing to think about, especially right now. I know we're in the middle of a pandemic. I'm recording this in May of 2020, and a lot of people are dying from this disease and this pandemic, and we're getting these mass amounts of numbers and confirmed cases and all of that. But for the drug overdoses, you know, it's one at a time, one person at a time, and it might not seem as surmountable, but this is a lot of people to pass away in 1 year due to drug overdose. And it is impactful, even though it looks different than maybe some other causes of death. It's tragic, and it's also something that we can help to educate and prevent, and I think that's really important. Okay, so for each of the 1,818 overdose deaths in Tennessee in 2018, this kind of talks a little bit more, breaks it down a little bit more, I guess. So there were an additional 10 admissions to the hospital for misuse and 26 visits to the emergency department for use, and then over 100 reports of misuse and over 700 reports of non-medical use of opioids. So that just kind of breaks it down a little bit per each overdose death and kind of shows you what's going on as far as admissions and going to the emergency room reports and that sort of thing. Okay, so thinking about life expectancy and longevity. So you can see from this chart here, in 2014, life expectancy in the US decreased for the first time in decades, while mortality increased. And then in 2013, life expectancy increased from 78.7 to 78.9 in 2014. So between 2014 and 2015, the life expectancy decreased 0.2 years and remained the same throughout 2016, but decreased another 0.1 years through 2017. So just some interesting information there about life expectancy, and just kind of we see that decrease trend there from 2014 up into 2017 specifically. So research attributes the longevity decline to overdose deaths and deaths by suicide. In fact, opioid overdose counteract all other medical advances during this time, and drug overdoses involving fentanyl derivatives increased 45% in 1 year between 2016 and 2017. So that's a lot Fentanyl, again, very dangerous, very, very dangerous, and very small amounts can do a lot of damage. So that is overdose rates for fentanyl specifically increasing by almost 50% in 1 year, which is a scary statistic. We are almost done here, guys. Hang with me for a few more slides. So looking here, even if someone uses an opioid only for 1 day, there's a 6% chance that that person will be using that drug a year later. And even though they are indented for acute or short-term use, there's still a probability that they can continue to get them, need them, feel like they need them to survive, and can continue that dependency. So use for 8 days increases the likelihood that the person will still be using a drug in a year to 13.5%. So 1 day, 6% chance after a year that they'll still be using. 8 days, 13.5% after a year that they'll still be using. And then 31 days, that jumps the likelihood the person will still be using that drug a year later to 29.9%, which is a lot. 30% essentially of people who get prescribed an opioid for 31 days are going to continue to use it. And there's a lot of science behind that, and just how opioids can affect the brain chemistry, and especially misuse of opioids, and that even in just a few days, that addictive tendency can be there and can come out strong. And it really changes just the way that your frontal lobe, which allows us to have decision making, it really can change and affect that in a really negative way. So that's just really important to understand. Okay, so talking about just teens and adolescents, obviously we know that this affects our mentees, and your mentee might not be using drugs or even, surrounded by drugs in their immediate home. But I can guarantee you in some way or form, they're going to come in contact with someone who has used, is using, is talking about it, maybe has them in front of them. So this is really important that we are aware of this. So teens who receive a prescription for opioid pain medication by grade 12, by the 12th grade, senior year of high school, were at 33% increased risk of misusing an opioid between ages 19 and 25. So if they're prescribed an opioid pain medication for anything by grade 12, by the end of high school, they are 33% increased risk of misusing an opioid between 19 and 25 years of age. That's crazy. That's a huge, huge number. So thinking about that, have your mentees had a surgery or needed to take pain medication for something specifically medically that they were prescribed, and have you talked to them about that? Have you had conversations about this, especially if your mentee is older in high school or maybe even middle school? It's not, of course, with discernment is always important, but it's not out of the question to have these types of conversations. And just, do they know the effects that drugs have, and are they making sure that they're being mindful of that? Is really important. So among those with low predicted risk of future opioid use in the 12th grade, having an opioid prescription increased their risk of post-high school opioid misuse by 3-fold, so 3 times increased risk. So this really highlights the concern over adolescent opioid prescribing, especially as teens are prone to athletic injuries, dental injuries, or not injuries, I guess surgeries, and other accidents that could precipitate an opioid prescription. So think about that if you have a kid who is really athletic, into sports, I feel like almost every kid has to get their wisdom teeth out in their adolescence. I remember having mine out in high school. And so that's a commonality. A lot of kids are doing that. And so just other things that might affect them having a prescription. What are some things? So thinking through that a little bit. Oh, I forgot to click. My bad. So there are those 2 statistics. So that 33% increased risk of misusing between 19 and 25 years of age if they were prescribed an opioid pain medication before they ended their high school career. And then again, they're the 3-fold misuse as well. So those are those statistics. Okay, so a couple more, like I said here. So sometimes people might wonder why it's important to engage in prevention of other drugs, including alcohol or marijuana, cocaine, when the opioid epidemic is so problematic. So the simple answer to this is that any drug can increase the likelihood that a person will use heroin and, kind of get down that slippery slope as far as opioids. So there you see it on the slide. Heroin is highly addictive opioid drug with a high risk of overdose death for users. And I will say something about heroin. So let's say someone starts using prescription pain medication for an injury. They become hooked. They need more of it, and it's expensive to get it not prescribed. And so they're trying to find it, can't find it, can't afford it. Heroin is an alternative. It's a lot cheaper, but it's dangerous. Like I said earlier, heroin's been known to be laced with other things like fentanyl, which is very deadly. You don't know what you're getting. The cuts are very different. And so a lot of people turn to heroin to continue that high. It gives them the same effect, and it's a lot cheaper than the opioids. So just something to note there. So people who misuse alcohol are going to be 2 times more likely to misuse heroin. People who misuse marijuana, 3 times more likely. Cocaine, 15 times more likely. And then RX opioid painkillers, 40 times more likely. So that's kind of where that transition goes, like I talked about with heroin being cheaper. But this is really important, and misuse of any of these things is not good. It's not healthy and helpful for anyone, our mentees, us, anyone. And so it's really important to recognize that if there is a misuse of something else, there's a likelihood and a chance that that can continue. And the end of this could potentially end in death, an overdose death. And that is the last thing we want for any of our loved ones. So it's really important to note that. But there is some good news. Say thank God, because I know this has been kind of a downer, but important information to share. So while the opioid epidemic paints a bleak picture for our communities, there is good news. And drug overdose deaths are 100% preventable. So that means that communities can develop comprehensive strategies to prevent and reduce misuse, which is really important. So look at these resources here on the screen. This is also in our mentor portal. It's titled Additional Opioid Resources. So I think this is where you found this video in our mentor portal online, klf.org. Go to Amachi and go over to the mentor portal, and you can type in the password that you received via email, and you can get into our mentor resources if you are a mentor. So that is there as well for you. If you want to take a screenshot, you can, but you can also look that up on our mentor portal. So there are a lot of resources available to help communities establish a strategic plan that can ultimately save lives. And this is really important. So I think these different hotlines and websites are really helpful, and I think worth noting or having available to you. So free confidential mental health support, we've got treatment and referral information, engaging information on substances for teens, families, and mentors. You've got the National Institute of Drug Abuse. Operation Prevention is a great resource. They've got a parent toolkit. They've got some information about how to talk to youth and kids about drugs and opioids. So a lot of helpful information there that they really break down. And then the U.S. Department of Health and Human Services. And then locating a treatment facility in your area, and then the East Tennessee specific information and resources. You can look at Metro Drug Coalition and then the Tennessee Department of Mental Health and Substance Abuse Services. So those are all really helpful resources for you guys there. And you can, again, check that out on our mentor portal. So here is our Amachi Knoxville Leadership Foundation mentor resources there. If you want to drag that over, I guess you can't really click the hyperlink on a Zoom PowerPoint call, but that is the link specifically for the mentor portal. But also, if you just go to klf.org and then navigate over to the mentor portal, you'll see that as well. And then that's our password for right now for you guys to get in as mentors. So again, I hope this was helpful. I know that it cannot always be the most happy subject. It's quite daunting and just can seem bleak. But again, know that the education is really important, and that's why we're doing this. We want you to be informed and educated, and as you have questions about your mentee and how to talk with them, or if you're concerned for their safety or well-being or those in their home, we want you to have resources available, and that's really why we created this. So if you have questions, definitely talk with us more about it. You know, you can always reach out to us. You've got our contact information, and we would love to continue the conversation. And I hope to do more of these trainings. This is just the first of several trainings that we have been given. So I did not create this training by myself by any means, but it's a helpful just training that we've been using through Knoxville Leadership Foundation and USDA. So hopefully it was helpful, and I hope you guys have a wonderful day, and we'll see you soon.